Hey, everybody. I'm not going to call the meeting. We got a minute beforehand, but hello.
Good afternoon, Mayor.
I hope everybody is well. All right, it's 7 o'clock. Are we being recorded? Broadcast? There we go. Good evening, everybody. It's February 22nd. This is the regular meeting of the Mansfield Town Council. I'm calling the meeting to order. The first item on our agenda is the calling of the roll. Ms. Green, would you please call the roll?
Yes, Osberger.
Here.
Berthelot.
Here.
Bruder.
Here.
Bertoni.
Here.
Freudman.
Here.
Kotchenberger. Moran.
Here.
Shuren.
Here.
Shaken.
Here.
Thank you.
Can I ask you to turn your speak microphones off, please? We're getting some background noise. Mr. Osberger, if you could turn yours off as well. Thank you. The first item on our agenda.
Yeah, I'm trying to get this icon to come up.
The first item on our thank you. The item on our agenda is approval of the minutes. Mr. Shaken.
Before we move to that item, Mayor, I'd like to propose a motion to add 2 items to our consent agenda, which doesn't appear on the agenda in front of me, actually.
Why don't you move to create a consent agenda with the 2 items?
I'd like to move to create a consent agenda that would be voted on after item number 8, new business, containing the approval of the minutes and the financial statements, item number 8A.
Is there a second to Mr. Shaken's motion? Ms. Berthelot seconds. Would you like to speak to your motion, Mr. Shaken?
No, I think both of these items are things we can approve on a consent agenda. We could discuss them briefly then if we'd like on the merits, and obviously if anyone objects, we can pull them back like we talked about last meeting.
Any further comment to Mr. Shaken's motion? Mr. Freudman.
I'm not here to argue against the consent agenda. That ship has sailed. But I'll tell you what I do argue against. Last minute changes to the agenda. If this had been printed up ahead of time, that's one thing. I will say up front, I don't know that I'm feel the need to comment on these items or have any opposition to those 2 agenda items. So this isn't based on any opposition to anything. It just is not right. I don't think. I understand there are situations that come up at the last minute where something is of a time-based nature, had been overlooked when the agenda was being prepared, and you feel, oh my God, we were up against the deadline, we forgot to put this on the agenda, let's add it at the minute. You know, the public has a right to know what we're doing and when we're doing it, and not to bring, there should be a higher bar for making changes to the published agenda. It shows. I'm not saying there's anything illegal about it, but it would show greater respect, greater fidelity to the Freedom of Information Act, and not just change something at the last minute unless you absolutely have to. Also, the idea of approving the minutes much later in the meeting than what we've ever done before seems incredulous to me. So I will oppose this motion, not because I'm trying to fight a battle against consent agenda. That's over. I'm just saying, do it ahead of time. Put it on the, print it up that you're going to do it and have it up on the, several days ahead of time before the meeting. Don't bring changes at the last minute unless it's something absolutely necessary. So it's for that reason, the suddenness of this, the last minuteness of this, that's not a real word, that I object to. That's what
I'd like to point out that there is no change to the content of our agenda. It is merely a procedural mechanism for how we vote. And the one thing that a consent agenda will require is that we are prepared for the meeting and prepared to know which things we are ready to vote on and which things aren't. Are you requesting that something be pulled from the consent agenda?
Madam Mayor, I'm not asking that anything be pulled from the consent agenda, but and I made my argument against doing this a moment ago, but I do have a question that is probably maybe a parliamentary inquiry. Seeing as this won't come up until much later in the program, 8A, if this is not going to happen for me anyway, if you go ahead and this motion passes, but let's say I or somebody else, when we get to item 8 and then we're approving the minutes, what if somebody decides then, oh gee, I really did want to pull it from the agenda? Will they have relinquished their chance to do it by passage of this motion?
It's my understanding that any member who wishes to remove an item from the consent agenda at any time before it is voted, before the consent agenda itself is voted, may do so.
Okay, I don't mean to interject, but I think I still want to just finish this. You know what? I will vote for it this time, but I would really ask, just in the interest of respect for FOI, if you really want to put things on the consent agenda, start doing it ahead of time. This is not a good way to start off with a consent agenda. Let the public know what you want to do, and I appreciate the mayor's explanation that even if much later something comes up on the consent agenda, people could at the last minute, they haven't relinquished the right to pull it. So I'll support it this time, but please, in the future, if it's that important to you to have a consent agenda, have it up there. Thank you very much.
My apologies. It's my problem for having missed that on the agenda as I did the agenda review prior to this meeting. Mr. Shaken.
Thank you, Mayor. Yeah, I just want to point councilors, they did receive a revised agenda in their email a few hours ago from staff. It was an error that the consent agenda was omitted, and I appreciate Mr. Freudman's concerns. I think the idea behind trying it out before we start adding items to it as a proposal is, in fact, to take Mr. Freudman's concerns into consideration, that as he had raised them prior to our adoption, which is to not have the agenda be put forward by the mayor, assuming the consent of everyone on certain items, that we would make that decision affirmatively each evening, at least to start. But regardless, tonight, this is the motion that I have made to add a consent agenda in the place that I've made it to our notice motion to include these two non-controversial items.
All right. Are we ready to vote on the creation of the consent agenda and the inclusion of the minutes and the financial statements? Is there anybody who wishes to object to this motion? Seeing no objections, is there anybody who wishes to abstain? All right, then I will rule that the motion has been adopted unanimously. Thank you. So the next item is approval of the minutes. Is there a motion to approve the minutes of February 8th?
Well, Tony, it's been added to the consent agenda.
Sorry. Yes, obviously. Is there anybody here from the public who wishes to address the council? Mr. Aylesworth?
Madam Mayor, I did receive a voice message. I did not receive anything in writing, but I received a voice message from Mr. Eric Holinko regarding the proposed ordinance. I don't know if you want any of that information shared here and now, or you want that just shared later?
You know, we have made rules on accepting emails and a public appearance and a phone in, but we've never ruled on whether or not we would accept a voicemail. I would suggest that since our motion on the ordinance is to move it to a public hearing, that we ask that this voicemail be transcribed and added to the communications received for this meeting.
Okay. And I did also, I spoke with Mr. Holinko briefly today, and I did let him know that depending on what the conversation was or the determination was of the council tonight, that there would be a further opportunity for a public hearing if it moved forward. So.
Good, thank you. Mr. Kotchenberger.
Just a question on that. Did he, because we really want to obviously make it as easy as possible for people to comment, he did not send any email or any written communication to us?
He did not. A voice message was left on the town manager's general line, I believe, on Thursday or Friday of last week, and I spoke with him this morning, letting him know basically this, I don't know if you want to call it a dilemma, but basically, you know, told him that typically either a member of the public would speak to the council during the meeting or provide comments in writing, and he basically said, well, you know, you can report on what I told you in the voice message.
So I think the same, my thoughts stay the same, that if we can get it transcribed and used as a communication, that would be sufficient. Mr. Shaken.
Yeah, I was going to finish up, Tony. I just wanted to finish. No, I just wanted to finish up. I mean, but go ahead. Never mind. Go ahead.
Mr. Shaken.
I was going to suggest the rules we passed the last council meeting gives Mr. Aylesworth the ability to change or otherwise write what's on the top of the agenda in terms of how the council accepts public comment. This is a new scenario, so I'd encourage Mr. Aylesworth, if he can figure out a way for us to hear the voicemail technologically, to include voicemail as an option at future meetings. And as long as we can hear what Mr. Holinko has to say in one way or another, whether it's transcribed or played to us, I don't particularly mind. And we have been reading emails that people have sent us aloud at council meetings. And so I also wouldn't mind if Ryan can play the voicemails for us right now. We could listen to it now. It doesn't make a difference to me, but I think either way, his voice will be heard.
Mr. Kotchenberger.
Just on that, I mean, unless we know that, you know, in this case, Mr. Holinko, but whoever is calling, unless the person knows that their voicemail will in fact be, you know, heard as their public statement, I don't think we should do that, even though, you know, probably in this case, there wouldn't be any switch. But, you know, I think people should, you know, we could make it clear, perhaps in material, that you can leave a voicemail and request that be communicated rather than written testimony, or that you do so, you know, repeat it or say it again in a live meeting. But unless we do that, I don't think we should play voicemails.
Exactly. That was what Mr. Shaken suggested, that unless that Mr. Aylesworth can figure out a way to do it and put it on the top of our agenda, that we would not deal with voicemails.
So I do have a way of playing the message. So whatever the pleasure of the council, we can save it for a future date, if there is a future date, or I can play it right now. I believe the audio would probably work okay. I cannot play the audio, obviously, from my microphone because that'll cancel out the speaker. But if I play it from my phone to this microphone, we can give that a try, whatever the council's pleasure.
I think that will create echoes. I really want to stick with my original ruling on this. We'll get it in writing, and we'll have it appended as a communication, and it's welcome to follow our general practice regarding the public hearing if such is scheduled. So now, opportunity for the town manager's report. And we have all received that electronically, at least earlier today or this weekend, Mr. Aylesworth?
Yeah, it was sent like 5. It was weird. Somehow the email that was sent first attempt was at noon. I guess that did not go through, so I apologize for that. I'm happy that I caught it just before 5, that it hadn't gone through, so you at least got something. But I will move through this. So right now, as everybody's aware, residents 65 to 74 are eligible for the COVID-19 vaccine. I'm not going to go too deep into COVID notes from my report because obviously we have a segment on the agenda for Rob Miller from the Health District to do that. I did, though, want to read some information that was provided to me from updated information, I should say, from our Human Services Director relative to the work that senior center staff are doing. In terms of supporting seniors and getting their COVID vaccinations, we are helping people register with VAMS via telephone or in person. We are offering computer access for those individuals that are unable to utilize a computer but do not have access to one. We are assisting seniors navigate the various avenues to get vaccinated, and we are referring them to other clinics that are not in VAMS, such as Walmart, Hartford Healthcare, CVS, and the Connecticut Vaccination Assist Line. We're also providing medical transportation to vaccination appointments. Senior center staff have made over 200 outreach calls to residents 75 and over, offering information and assistance. Senior center staff responded to over 425 requests from residents 65 and over for general information assistance, registering for a vaccine appointment, and getting added to the Health District shortlist. Senior center staff have provided in-person assistance and technology access to many seniors, and our transportation program has provided transportation to vaccine appointments for about a dozen residents. So that's all encouraging. Of course, we want to find ways to continue to do more and to do more better in better ways, but I think progress continues to be made on that front, and I'm very much pleased by that. Go back to my report. The fire chief's position, first round interviews with candidates that met the base qualifications are happening tomorrow. We've assembled a panel of combination of retired fire chief, active fire chief, a senior member of the command staff within the fire department, the DPW director and human resource manager or director of human resources. So we'll see how the first round goes tomorrow and how many individuals proceed on to the next phase of the process. We continue to make progress on the development of our 2021-2022 budget, and you can expect to receive your customary recommendations from the town manager late next month. I've been invited to participate on the, I'm going to say Willie AM FM radio. I'm not sure if it goes by a different name, WILI. Willie AM and FM radio program hosted by Wayne Norman. That'll take place the next few weeks. My understanding is that the town manager in Wyndham has a recurring segment on that program. And so potentially, I'm not sure that my appearances would be as regular on the program, but it's possible that I may be a more frequent guest. So I appreciate that invitation. The Taste of Mansfield initiative aims to connect the community through local food. This week, I'm going to be leading off a Facebook Live event coordinated by our partners at the University of Connecticut's Extension Program to promote CSA Sign-Up Week in Connecticut. CSA stands for Community Supported Agriculture, enables consumers to purchase in late winter a share of a farmer's production for the coming growing season. A box of fresh vegetables and other locally produced items is then picked up each week directly from the farmer throughout the season. Taste of Mansfield has produced a video about each of 4 CSAs in Mansfield, which will be featured in the Facebook Live event, which is tentatively planned for this Wednesday. Scheduling is a little bit flexible right now. I'll be also announcing the availability of subsidized CSA shares through the Mansfield Farms and Family Program for families who may not find a CSA share affordable within their budget. And the program is going to be administered through the town of Mansfield's Human Services Department. One of the things I wanted to just briefly introduce you to as a concept and kind of earmark it for more robust, dedicated discussion, a specific agenda item in all likelihood at a future meeting, is the topic of strategic planning. My own experience with this, I believe, very favorable experience with strategic planning, and by extension, something called strategic governance. When I was the town manager in Enfield, departments engaged in this process in ways that they had never done so before. There had been a lot of strategic thinking and operations planning to various extents, but never anything really comprehensive and detailed at a department level. And since the town of Mansfield already has a very impressive plan of conservation and development, POCD, the Mansfield Tomorrow Plan, which was developed and finalized in 2015 to cover a roughly 10-year period, with the next plan to be developed and implemented by 2025. The thought process here is to kind of do a midpoint, if you will. We're about 6 years in, 5 or 6 years into the Mansfield Tomorrow Plan. So I have an interest in working with an outside group in FY 21-22 to explore ways to better integrate department level planning with the Mansfield Tomorrow Plan, and also do what you might call a light refresh or update to the Mansfield Tomorrow Plan. So that's very much the thumbnail sketch. Happy to talk with members more one-on-one between now and our next meeting, but what I'm looking to do is probably at the next council meeting, if not next meeting, perhaps the one after that, set aside some time for a subject matter expert in this area. Won't necessarily be the outfit the town would even work with if this moved forward, but bring a subject matter in to talk a little bit more about it, and kind of just do a 30,000 foot, kind of walk through that process. The budgets for both Mansfield Public Schools and Region 19, well, one is completed. The school board for Mansfield Public Schools voted to adopt the superintendent's recommended budget. I believe that was last week. Represents a 2.29% increase over the current year budget. Budget of roughly $2.3 million. I included a link in your packets or in my report to the detailed budget. And then likewise, Superintendent of Region 19 has submitted her budget recommendations, very similar budget figure to $22.5 million, an identical, interestingly, 2.29% increase over the current year's budget. Our allocation as a town would be roughly $11.3 million, which is approximately a 2.16% increase over our allocation in this budget year. That budget still has a ways to go. They haven't done their budget workshops yet, but she has submitted her full budget recommendations to her board. And the board will be voting, I believe, at the conclusion of their workshops. I believe it's either the last week or around the second to last week in March. I don't have the schedule in front of me. I've included an activity log for the fire department, fire and EMS calls. We are continuing to accept applications for emergency child care assistance from residents who have been financially impacted by the pandemic. If residents go to Mansfield's website, there's a very prominent tab for COVID assistance that they can access. Residents are encouraged to complete a pre-screening form prior to starting the application to identify potential eligibility concerns. And perhaps most importantly, questions should be sent to helpinghand@mansfieldct.org. In terms of economic development, the town will be placing an ad in the March edition of Site Selection magazine, highlighting Mansfield as a great place for business development. The audience for Site Selection magazine is real estate decision makers and site selection professionals. The town ad will supplement a full-page ad from the state of Connecticut through the Department of Economic and Community Development and Advanced CT. And I want to extend a special thank you to Kathleen Patterson with the Downtown Partnership. She worked, things are always difficult to do by committee. You're trying to integrate a lot of different feedback and put together something that everybody's happy with. But she did a great job. And since I didn't circulate it as part of this packet or have Tasha included as part of this packet, I'm happy to circulate that to the council so you can see exactly what that what that ad will look like. The town clerk and other members of her staff team recently completed certification training on vital records and several computer security training modules. The vital records training was provided by Connecticut Town Clerks Association and presented by staff from the Connecticut Department of Public Health. The security trainings are provided by state contracted vendor and are designed to enhance election security. Last but certainly not least, Public Works. Since the last report, the department removed 3 trees and pruned 1. Since the last report, the department responded to 3 storms and 3 treating events using approximately $43,000 in overtime and 638 tons of treated salt. Salt is an issue right now. The town's contractor, DRVN, commonly referred to as Driven, has depleted all supplies. It's no longer allowed to use the Port of New London. Suffice it to say, there's a lot of politics at play right now, which is unfortunately not being able to get material from a contractor it's very, very happy with. It's impacting a lot of towns right now. And we're trying to figure out how to respond to this so the town gets the best outcome possible. However, we did receive approximately 200 tons of salt today. And according to Director Carrington, we should be able to limp through right now, unfortunately, with our supply being a bit disrupted, limp through the remainder of the season if winter proceeds sort of as expected. And of course, it's hard to expect or project such things. At this time, the department has used approximately half of its $225,000 salt budget, perhaps a little bit more than that as of this report now, and closing in on using 100% of its overtime budget for the current year. However, because the snow removal budget, it's its own separate fund, there's approximately $100,000 of unexpended funds carried forward from last year that can be made available to supplement this year's budget as needed. Oh, I did mean to say, and I see now I overlooked it, members of the fire department drove fire trucks in a parade of 50 plus vehicles organized in honor of Mansfield town historian Roberta K. Smith on the occasion of her 100th birthday. This was Sunday, February 14th. The proclamation from the town council was also presented to Ms. Smith along with other gifts by the Mansfield Historical Society. And from what I've been told, tremendous appreciation for all those that helped pull that together. And the rest you have in my written report.
Any questions for Mr. Aylesworth? Ms. Berthelot?
Thanks, Mayor. Super excited to hear how much involvement the town has on helping folks get registered and get vaccinated. That's really terrific. Thank you. Also, continue to be super excited about the Child Care Assistance Grant. I'm curious at this point, is the town taking applications, and what is the sense regarding the success of our outreach? Are we reaching people, or are we hoping the next wave of activity through the schools will bring people in?
So there is that email address that I laid out, and then there is information accessible on the website. The website has frequently asked questions about the program. We're in the process this week of distributing what I guess could be described as basic information to all Mansfield school families, and details are being mailed to all registered child care centers for them to then share with their families. And that's a general overview of where we are right now.
I guess are applications actually coming in at this point, or is the date of applications further along?
Yeah, so we received, I'm not sure if it would call them full applications, but in talking with Linda Painter earlier in the week, we did have a few folks who submitted materials just basically by word of mouth because we hadn't, done the e-blast or the mailing yet. And in some cases, one of the things that we've talked about that's part of the eligibility criteria that has to be evaluated is whether or not individuals applying have other sources of funding which they can access to address the same need, because obviously we want to make sure that we're helping people that don't have any other form of assistance. And so there were, I believe, without knowing the details, my understanding is that one or more, I wouldn't even call them applications, perhaps I call them inquiries. We were informed by people who said that they planned to submit applications, that they also had an application pending elsewhere. And so we really need to know what the disposition of that is before we make any funding determinations at our end to ensure that, you know, we're not giving funds to a family that received it from another source of grant support.
Mr. Freudman.
Yeah, Mr. Ellsworth, could you explain, if I heard correctly, you wanted to hire an outside consultant to redo the town's plan of conservation and development? I wonder why now, especially since the Department of Planning and Development is in the process of doing so much and changing our regulations and special design districts. I mean, these things change. As soon as you have a plan of conservation and development, things change and evolve anyway. Why the need to do this now? And those studies are very expensive. We did one a few years back and it cost over $600,000.
Right. I appreciate the question, so it gives me an opportunity to clarify. The work we might do, underscoring might, but the work we might do with an outside group would really be focused on department level plans, strategic plans that I described. And I only brought up the POCD, the Mansfield Tomorrow Plan, not to say that we would be working with this outside group or an outside group to do a wholesale update of that plan, but referencing that in a way to make sure that the department level plans were logically tied in, so that one thing was reinforcing the other. So the department plans were not, to the extent that, you know, these plans are linked and the goals names are linked. Department programs, activities are not pulling us in a direction that's inconsistent with the values and goals expressed in the Mansfield Tomorrow Plan. I mentioned a light refresh. Again, this is all something that can be discussed only because I don't know Mansfield's experience has been, but it's quite common, even if a plan is intended to be for a 10-year time horizon, which this one is in this case, 10 years is a fair chunk of time, and it's quite common, even if it's not done with outside help, it's common for communities to, at somewhere on the midpoint, the year 5 or 6 mark, make sure that the plan in place, nothing needs to be finessed or tweaked a little bit, so that it's, for lack of a better term, not such a jarring change when the next full iteration of the next 10-year plan is worked on a decade later. So it's kind of the idea that if you do a midpoint review, the next 10-year plan, it's a little, it's still going to be a heavy lift, but it's a little bit lighter lift.
Let me clarify something a little bit. The Mansfield Tomorrow is more than a plan of conservation and development. It is the strategic plan for the town as a whole, not just for land use and economic development. So it includes things like the council's involvement in public housing and human services and a wide range of things that affect the general town. So we merge two documents which are processes which are normally separate into one document. And I think that what Mr. Aylesworth is talking about is the part that applies to the town government as a whole in terms of our strategic thinking for where we want to go. This would be something that we might normally think about in terms of setting goals and strategies for the council, and which I have recommended that we don't do until closer to the next election, if not after the next election, because we don't want to impose old views on new councils. But in any case, this would be working with the staff to see what our opportunities and challenges are as we go forward in a much more general way, not just zoning regulations. Anybody else wish to comment on Mr. Bruder?
If I could, I'll keep it brief. I just wanted to thank the town manager for putting together this report. It sounds like he's really hit the ground running, and I hope that you're enjoying doing all these different things. So thank you so much for giving us this report.
Thank you very much, Mr. Bruder.
I don't know whether you know Mr. Aylesworth, but Wayne Norman has the longest running television show in the state. And he has broken the record of the prior longest running television radio program in the state, run by the much beloved Bob Steele. So Wayne Norman is an icon, and it's a very good thing to get on his program, and I hope you get there on a regular basis.
And do I understand, is he also the play-by-play announcer for Huskies basketball?
I don't watch his basketball. I
believe that's the case.
Public,
I don't know
but
if
I don't know the answer to that
men's
question.
or women's or both, but I believe I was reading that somewhere.
I believe he started that as a student reporter back in the dim, dark ages of the past, and he has done it ever since if he hasn't retired.
I definitely very much appreciate the invitation to appear on the program.
Okay. Anybody else wish to ask Mr. Aylesworth the question? If not, we'll turn to reports and comments of council members, and I have several. First of all, I have been informed by the Downtown Partnership that we have a vacancy as a town council. We have 3 seats, the mayor sits ex officio, and we have appointed Mr. Aylesworth and Steve Farino, who is head of our Economic Development Commission, to that board, and we do have a vacancy. And I would like to add an agenda item under new business to appoint the 3rd member of our board. So if somebody would make that motion. Ms. Berthelot, could you make that motion?
I would, but I saw my colleague, Mr. Bruder, with his hand in the air. Would you like to do it, Mr. Bruder? Or
I think Ms. Berthelot would be more appropriate under the circumstances.
I'm not sure I followed them. What happened?
You will.
Okay. So I move under new business to add a new town council member to the economic development zone. It's economic development. Downtown partnership board. Or just
There's a second.
Thank you.
Seconded by Mr. Shuren. Anybody object? Anybody wish to abstain?
We have a discussion?
Okay, go ahead, Mr. Freudman.
Yes, are we appointing somebody from the council? Is it
Yeah.
a vacancy from someone from the council?
Yes.
Okay, I was afraid it was, like a citizen representative, and then I'd want it, plenty
No,
of.
it's a council member.
Okay, I'll support the motion, but once again, I think there should be a higher bar for adding things to the agenda at the last minute. As I said before, with the consent agenda, there are times where something comes up, you forgot to put something on the agenda, it's time critical, and we do it. But, the spirit of the FOI, I'm not saying there's a violation here. It obviously is not. But the spirit of the FOI is not just to say you're having a meeting and here's the place. But the idea is, notify the public what it's about. And the more often that you just add stuff that could have waited, it kind of takes away from the spirit of the FOI. This could wait. I'll support the motion since you just want to make appoint somebody right away. But the public should know and be notified ahead of time whenever possible. And this could wait.
This position has been vacant for some time, and it really needs to be filled. Any other further comments on the motion? Anybody wishes to abstain? Anybody wishes to vote in the negative? Thank you. We have added an item under old business, and it will follow the ordinance on firearms. Okay, the rest of my report. I participated in the parade past Ms. Smith's home on last Sunday, And I am pleased to report that she stood in the door and waved and looking different than she did about 15, 20 years ago. So we are wish her the best of health for whatever comes next, and appreciate both the fire department and the historical society and her congregational church for their attention to this. The second thing I wanted to report, the third thing I wanted to report is that I received a communication from a member of the public who was particularly congratulatory about the services provided by the senior center around food delivery, and particularly one member of the staff who has been extraordinarily helpful and friendly and kind to some very elderly folks in our town. In this same communication, she also reported that her mother had several caregivers who have gotten their shots in various places around the state, their vaccinations, and that Mansfield was by far the best organized, the friendliest, and the quickest to report the results of their vaccinations. So that's kudos to Eastern Highlands Health District for sure, and to Millie Brousseau in particular. So that's my report. Does anybody else have anything to report? Okay, then let's move on to Mr. Miller and the COVID update. Mr. Aylesworth, do you want to start, or?
I don't believe I have anything else to add than I did not touch on in my report, so I'll just turn it over to Rob.
Welcome, Rob.
Thank you, Madam Mayor, and thank you to the council for once again permitting me to provide you updated information on the local response to the pandemic. Let's start off with just a little bit of information about current status of cases, both locally and in the state. As I'm sure many of you have heard by now, case counts are definitely trending down and have been pretty steadily now for the past 4 or 5 weeks. The Eastern Highlands Health District population has also been trending down in a very similar fashion. Over the past 5 weeks, there's been a drop of 59% in the weekly case counts for the health district population. The town of Mansfield case counts haven't trended down as steeply as the rest of the health district. I'm speculating that is at least in part due to the arrival of the students for the spring semester. While I do believe that case counts among the year-round residents have dropped, and consistent with what the rest of the district experienced, and I think that's been offset a bit by new cases among the student population. In terms of testing, the Wednesday event at the middle school continues to operate every week. Currently, that schedule is planned to extend through the second week of March. Still some uncertainty as to how far after that. Currently in communications with state officials on where that's going to go. But I can tell you that demand for testing has dropped quite a bit, from our peak, during the holiday season when there are as many as 250, 300 specimens being collected. By way of example, last week, 113 specimens were collected, of which zero of them were positive. In terms of the vaccination campaign, the health district has put out about 3,370 total doses since the onset of the campaign, end of December. A little over 2,300 of those are first doses, and around 700 have been second doses. Last week we did 420 doses. And of course, you'll recall that these are at 2 sites at E.O. Smith High School which for the month of February has been our primary clinic site for first doses on Wednesdays, and then on the subsequent Monday, Tuesday, Thursday, Fridays, our smaller second dose clinics have been held at the Mansfield Community Center. In terms of vaccine coverage, you may recall as of February 11th that the town of Mansfield was at 65% coverage for the 75 plus population. Since then, the state, for whatever reason, isn't making the age-specific by town data available. Local health directors have asked them to make that available again, so hopefully they will at some point. But as of the 16th of this month, they've been reporting out total population coverage. State of Connecticut is at, let me just back up a little bit. As of February 11th, that 65% was above the then average for the state of Connecticut, which was about 53%. So Mansfield was ahead of the curve on that one. Going back to the total coverage of population, Connecticut as of the 16th is at 13% coverage. Again, this is for first doses. And Mansfield, adjusted for the university population, so this is the percentage for the year-round residential population. Mansfield is at 16%. And so that's, again, ahead of the curve as compared to the state of Connecticut. So a lot of people, I'm sure everybody's heard about the governor's press release and press conference today regarding a change in direction for the phased rollout of eligibility in the state of Connecticut. For those of you who didn't hear, effective March 1st, 55 plus population and educators from pre-K to 12 to grade 12 will be eligible for vaccination. There's a lot of discussion about that, needless to say. The new phased rollout is an age-based, with the exception of teachers. All the other priority groups are being rolled into those phased age ranges. Starting at 55 to 64, then 45 to 54, 35 to 44, and then 16 to 34 over the span of about a 2-month period. And so I can tell you that I did get out of a meeting just later this afternoon after the governor's announcement of all health directors with the state of Connecticut, in which the state provided further direction for local public health. They're asking us to spearhead vaccinations for the educators in our local communities. So my office is going to be collecting more information on that particular initiative, working with our colleagues to collect more information and kind of wrap our heads around this pivot in direction for local public health. The other thing that I want to just talk about briefly regarding the vaccine campaign, my office continues to try to stay in the loop on other possible mass vaccination sites in the area, Wyndham, Yukon, and perhaps the Vernon area. No firm plans as far as I could tell. I know there's been lots of activity around trying to nail some of these sites down, but at this point it's still tentative. I think a lot of it really is going to hinge on exactly how much vaccine is going to be available and at what point in time. So that concludes my highlights. I'd be glad to answer any questions.
Mr. Aylesworth.
I just wanted to, and thanks, Rob, for making mention of the governor's announcement today about the age cohorts. Rob and I and Chief Franklin, Acting Fire Chief Franklin, we met. I guess it was latter portion of last week. We had a discussion about the possibility and logistical feasibility, as it were, of doing mobile vaccinations to those that are homebound, those that can't get to a vaccination site. Because I know we all share the interest, obviously, in reaching as many people as we can and helping people in any way that we can, especially those that, whether it's transportation issues or some other hurdle, are unable to get to one of our more conventional vaccination sites. And Rob brought a lot of useful information to that conversation. Things like it's not just a matter of getting fire and EMS or firefighter, EMT, or medic trained to administer the vaccine, but actually needing to have a certified nurse to be there to oversee, supervise what's happening. And that obviously creates very much a human capital challenge for us if we don't have the ability to put somebody in an ambulance to do that. Also, there was concern about, given the geographic expanse that this would entail, concerns that once you open up a vial, I believe a vial has 10 doses, that the amount of time you have to get all those doses into somebody's arm could be problematic. Again, given the time it takes to get from A to B, concerns that there would be doses at the end of the day that could not be utilized and would therefore be wasted. And obviously that's a real problem, given that the vaccine is essentially liquid gold. And just, I believe Rob also spoke about the fragile nature of the vaccine. And once you, again, get into a vial, that, the concern that just the perturbation that doses would incur in transit could be a concern. And I believe West Hartford's doing this. They may have some workarounds here to address some of these problems. But Rob, any other details or clarification maybe on what I just said that you want to provide?
Well, it's obviously Mr. Aylesworth is highlighting some of the challenges associated with that. Part and parcel, or actually a big piece of that is the planning piece, and this is obviously logistical heavy lift, and all of that can be overcome. There are workarounds for a number of these, but it would certainly take an allocation of resources to make it happen, and so it's unclear as to where all those resources would come from.
Mr. Shaken.
Well, what should I start with? Let me start by saying Mr. Miller was very diplomatic, but the governor today really threw the entire plan out the window and completely rewrote the vaccine eligibility that the state has been telling everyone, health directors across the state and others, to plan for, and threw out CDC guidance and basically said it's too complicated, which is a fair assessment. And so we're just going to move forward and open by age eligibility up over the next 3 months, so that by May 3rd, the vaccine will be available to everyone. And I understand that's fine. I think it's very challenging to figure out how to manage it. So, good news for anyone who's 55 to 64 who doesn't have an underlying medical condition, who's newly eligible as of March 1st, but bad news for anyone who has an underlying medical condition whose mortality is, risks are worsened by their condition, who now has to wait till their age group is eligible. With that said, given that things are about to become a fairly complete free-for-all, and that it sounds like the state is asking health districts to pivot to vaccinating teachers, does it make sense for the town to try to pivot our resources that we have been dedicating to getting in touch with seniors to to sort of become the resources that would be necessary to implement some sort of mobile vaccination operation that could serve the homebound elderly residents of the town who aren't able to be served under the current system. West Hartford's clearly figured out a way to do it. We have some geographical challenges that they may not in terms of population density, but if the barriers are having a nurse being required for regulatory reasons on the bus with the EMT or the paramedic who's delivering the vaccine, and planning, we've got the senior center staff who's been dedicated to this outreach as of now, and as of March 1st are going to be somewhat out of work because everyone is going to end up eligible, and maybe they could be dedicated back into planning to get the remaining portion of the over 75 population who wants a vaccine but hasn't been able to access one, get one to their doorstep.
There's a question, Mr. Miller.
I guess I'm not clear on what the question was.
Well, my question is it possible, you mentioned resources being a challenge for setting up a mobile vaccination operation for Connecticut, for Mansfield's elderly homebound residents who've been unable to access the vaccination because they've been unable to get to a vaccination site.
Mm-hmm.
Are the resources that the town is dedicated to outreach to that community able to be redeployed to planning, how to use a 10-dose vial with a mobile vaccination clinic or something along those lines over the next month or so?
So certainly reallocation of some of those resources towards that type of initiative could provide a benefit and towards achieving that goal. One of the major challenges is my understanding, and I might have to re-review the commissioner's order on the expanded authorizations for vaccinators under which EMTs would fall, is that not only do you need a licensed vaccinator who's already licensed to supervise on hand, COVID vaccine that's already a COVID vaccine provider that has executed an agreement with the State Department of Public Health on the storage, handling, and management of the vaccine. And those criteria are very specific and very detailed, and are a big part of the planning and management that would needed to be dedicated to this. And so not only, I think, my understanding is not only does that vaccinator need to be licensed to vaccinate, to supervise, they also need to be employed by the vaccine provider that has that executed agreement with the State Health Department to assure that the vaccine is stored, handled, transported, and administered in accordance with the appropriate protocols to ensure safety and viability of the vaccine. So the bottom line is you need a vaccine provider who's got an agreement with the State Health Department. And while the health district is one of them, it's for us to dedicate a nurse right now in the midst of this, it would be challenging.
Mr. Miller, is Mr. Shakin's proposal desirable?
Of course it's desirable. Of course, absolutely. I think we want to certainly want to try to, if there's a way to get the homebound vaccinated, then in a manner, then obviously getting the homebound vaccinated is desirable.
I may have misunderstood his question. I thought he was suggesting that we redirect our resources away from homebound people to teachers. Did I misunderstand? Mr. Shakin, did I misunderstand you?
Well, no, but yes, although I thought I understood Mr. Miller to say that he expects the health district will be asked or directed by the Department of Public Health, State Department, to redirect their efforts to the vaccination of teachers. That's
correct.
As the governor has announced his expansion of vaccination categories, he is taking health districts out of the general public vaccination pool and having them run the teacher-only vaccination sites. Is that correct, Mr. Miller?
So his ask is for health districts, yes, to pivot and to spearhead the initiative to vaccinate educators in our public school systems. Along with that ask, they have clarified that they're not asking us to cancel any existing appointments that we've already made for eligible general public population, but to not make any new make any new appointments and to pivot to school teachers. Now, it's an ask, but I can tell you that my office has been working very closely for many months with our public school and our superintendents. While eventually we had anticipated that, we would be a part of vaccinating the teachers in our communities, it's just happening sooner than we had thought.
Mr. Bruder, followed by Ms. Berthelot.
Thank you, Mayor. I was just curious to find out how many homebound or residents are we talking about? I don't know if we have a number. I don't know if it's a percentage of, of the population that, like, do we have a percentage or do we have numbers or anything? But just trying to get an idea of, and I'm in full support of us having the ability, redirecting resources. So it's not that I'm trying to figure that out. I just want to know, how many do we have? Do we know of?
I don't believe we have a number. I had reached out or been in contact previously with Pat Schneider, our Human Services Director, about that. So while we're meeting now, I will double check that we do not have a reliable number.
Thank you. That'd be helpful to know if it's 5,000 or if it's.
Ms. Berthelot.
Yes, I had the same thought that Mr. Bruder did, that I agree with Mr. Shaken entirely that this is a super important population to reach, but we don't have our arms around how big a problem it is. And I would love to know, we've been told that there are lists of people that we're reaching out to. How successful is our effort reaching out to these folks? And are they getting vaccinated? And of that population of people, are some of them not getting vaccinated because they're homebound? Because using ambulance and a nurse, that's expensive, and that is tying up resources that we need to keep that in mind, how we're prioritizing things. But it certainly sounds like it's an important thing to consider. And the other thing I would remind everybody is that we do have home health agencies in town, and home health providers specifically provide home health care to people who are by definition homebound. So partnering with them to find out if they have folks who can't get out, and clearly they couldn't give us the information because of HIPAA, but they could make those folks aware that they can reach out to us and that we need to know that they're out there, and that we can do whatever is possible to ensure that they get vaccinated.
Mr. Miller?
Yes, just a couple of other additional comments on this topic. There are agencies that serve the homebound, which can be tapped to help identify them, such as TVCCA, which runs the Meals on Wheels program, perhaps VNA too, understanding that HIPAA applies, but there are other agencies in which could be tapped for that purpose. The other thing I just want to note is that it's my understanding that the state is working on some kind of plan for addressing the homebound. It's unclear to me on what that plan would entail. But I know that they did recently just push out the CDC's guidance on addressing those that are homebound. But I am anticipating at some point in time some kind of additional information and guidance from the state on how to address this very important but very challenging issue.
To come at this from a different perspective, what we know about teachers is there's a finite number.
Yeah, absolutely. So,
and they are mobile because they get to work. So it's teachers, paras, whoever is face to face with kids in the school. Mm-hmm. And I should think that it might be possible to reach those people in 2 or 3 sessions and then return to our regular practice. Is that possible?
So the health district has about 2,000 teachers and staff.
Well, the health
in the health district.
Yeah.
And so it's gonna at least take the month of March, and even that means us health district having to ramp up our weekly output because as I said, we did 420 doses last week. Now remember, about 250 of them were first doses. The rest of them were second doses. So the second and we continue to have second dose clinics that are already scheduled through the month of March for all those first doses we issued in the month of February that are going to be commanding additional resources from us in the vaccine campaign.
So just to close the loop on this, I'm going to be in contact with our Human Services Director tomorrow to do a brainstorm on the outside groups that might be able to help yield some credible data on homebound residents in our community.
Any further questions for Mr. Miller? It sounds like we've got a bottleneck here, and the problem is how to get people through it without people getting sick and without getting too upset. And when you talk to people who are homebound, one of my other concerns is they usually have multiple caregivers who are caring for multiple people. I sure hope those folks are all double vaccinated because they have a real strong potential to be carriers from house to house. Mr. Miller?
I was just going to say that, those home health aides that work for agencies have been eligible for vaccine for some time now. And we're certainly vaccinating our fair share of them.
Mr. Bruder, followed by Mr. Shaken.
Thank you, Mayor. I just wanted to clarify with Mr. Miller that it's my understanding that the vaccine works to reduce the symptoms, but that it doesn't actually prevent spread by somebody who's been vaccinated. Is that accurate to think of, so that you should still continue to wear a mask and socially distance even if you've been vaccinated?
What I can tell you, can I clarify that point, if I may? Recent guidance which came out from the CDC identifies a period of protection against transmission to others, and that period has been defined as starting 2 weeks after your second dose, and then 90 days after that. So that for that period of time, it's in effect a get out of quarantine free card. At least, and that's based on recently made available data, which indicates that there is protection against transmission from this virus. And the reason it's only 3 months is because they've got about 3 months worth of data. So as time progresses, they're going to get more data and be able to draw more conclusions about immunity on a longer term basis and about the protection against transmission on a longer term basis.
It sounds like at least the beginning of that doesn't occur until 2 weeks after the second shot.
That's the current guidance, yes.
Great, thank you.
So I got my second shot today, and in 2 weeks I'm going out. Mr. Shakin.
Thanks. Just to the point, Mayor, that you raised about caregivers working with folks who are homebound. Even though those folks are eligible for the vaccine, we're seeing uptake rates among healthcare workers to be at best about 50%, and in certain settings like nursing homes to be as low as 30 or 40% for a variety of reasons. It's going to improve. It's going to get better. But for now, it's not by any stretch of the imagination something that is being, chosen by every healthcare worker that you encounter. And so that's why I'm pushing on working to figure something out for homebound folks, because I don't think even though their risk has been reduced, it's going to be eliminated for some time until they're able to get vaccinated, even if they're only interacting with caregivers.
Mr. Miller, there's been some discussion about whether an employer can require employees to be vaccinated. Now, obviously, a government can't. I'm not quite sure what a government can or can't do, but can an employer require its employees to be vaccinated? So could you say, could one ask?
Well, government certainly has required vaccination. Look at immunization requirements for school-age kids and for college kids administration, although that's not government. And I'm not a labor attorney, but there certainly have been employers who have required their employees to get vaccinated. Hospital systems, for example, many hospital systems require their healthcare providers to get flu vaccine. So there are certainly precedent for that. I'm not sure we're there. I'm not aware of anybody who's requiring the COVID vaccination at this point in time.
Okay, any further questions? Well, once again, thank you very much, Mr. Miller, for your attentiveness to this and for the very fine running of the Eastern Highland Health District. We continue to hear compliments about the process and your staff and so on. So thank you.
Thank you very much, Madam Mayor.
Is the Ad Hoc Committee on Drafting an Ordinance Prohibiting Firearms and Other Deadly Weapons. Mr. Shakin, you are the chair of that committee. I believe you have a motion.
You did. Sure. I'd like to give a brief summary of our committee meeting, followed by the recommendation of the committee. At the last council meeting, you all appointed this committee to include me, Peter, and Charlie to take a look at this ordinance. We met on Wednesday with the town manager and the town attorney, who's here tonight if anyone has any questions, and discussed what Mr. Deneen had sort of discovered in his research about the prevalence of these ordinances around the state, about the constitutionality of such an ordinance in either Connecticut or in the country. And Mr. Deneen also presented a draft, which we made a slight modification to, and which is not in your packet as we passed it. So you need to make sure you look at your email. You have an email from Tasha at 5:15, which contains the actual draft we passed. The change that we made was to clarify that we are not aiming to prohibit anyone possessing a firearm or other dangerous weapon in their vehicle while they are on town property. That was after some discussion with Mr. Osberger, who had a concern about folks who who have a practice of carrying firearms in a vehicle, but would want to leave those firearms in their vehicle when they went into a town building or exited their vehicle in some other way. And so we added language to exempt that practice. I should note that the Connecticut state statute does ban the possession of firearms in all situations, including that situation that I just mentioned, on school grounds. So if someone was visiting, for example, E.O. Smith High School next door to the town hall and had a firearm in their vehicle, they would be committing a felony in Connecticut. And that is, that's the case on all elementary and secondary school grounds and premises. But regardless, we decided as a committee it made sense to exempt that practice here, and the ordinance passed the committee unanimously. So the motion that's in your packet is simply to schedule a public hearing on this proposed ordinance. I will also say that there is likely to be, after that public hearing, one other small change that needs to be made. It's become evident to Attorney Deneen that Camp Mansfield offers archery programs for kids in the summer, and so we need to add some language to the proposal, which we can do if we decide to take it up and pass it at later meetings, to allow for archery programs for kids to continue. But anyhow, when we have the public hearing, if we then at a later meeting decide to take up the ordinance, I would expect to have a full written memo from Kevin about the legality and constitutionality in his research. But I hope you will all believe what the committee talked with about him in terms of its legality. And again, this is just for a public hearing, so we want to hear from the public before we move forward in any way as part of our ordinance procedures.
Mr. Shaken, would you like Mr. Deneen to say something to the council as a whole before your motion comes before us?
Sure.
Mr. Deneen, are you prepared to tell us something about your researches?
You're muted, Kevin.
Pardon me. Thank you, Madam Mayor. So there's a number of different layers or areas to look through on this. The first was looking at whether municipalities in general have a right to enact these types of ordinances on that. Because as you are all aware, under Connecticut statutes and laws, the municipalities can only do those activities or enact those areas in which the state has given them authority to do so. And both under a number of the different provisions under 7-148 and that deal with the town's ability to control its property, it's important to note again that we're talking about town buildings, town property, not general prohibitions on people lawfully owning or possessing firearms on non-town property. So in general, without for the purposes of tonight going into great detail, I do believe we have the right to enact these types of ordinances. And frankly, they are very common ordinances throughout the state with regard to not necessarily possession in town buildings, but in town parks, town properties. And as Councilor Shaken mentioned, there are state statutes not only that deal with possession of firearms on school grounds, but there are statutes dealing with possession of firearms in buildings in which the General Assembly is meeting. There's a number of other places that are on there. The Judicial Department, there's statutes that deal with that. So the ability of a governmental agency or governmental entity to control its own property, I think we have that ability to do so. Then it became a question of looking at whether or not either under the state constitution or the federal constitution, there are problems with regard to that. And again, with regard to an ordinance which is crafted to deal with possession of lawfully possessed firearms within a governmental entity's own property, I do not believe that there's a problem either under the federal or the state constitutions. The U.S. Supreme Court, you can't carry a firearm in there. You can't carry in any number of places that we're on there. So if the council wishes to enact such an ordinance, I do believe that that would be upheld. One of the things we did talk about as you move further out of the building itself or the town property, the U.S. Supreme Court, for example, took up a case from New York, which effectively limited where you could carry a lawful firearm outside of your home, and you couldn't travel on city roads other than to 7 specific approved shooting ranges within the city. The Supreme Court took that case up. It appeared to most observers that they took it up in order to reverse that. In the interim, the city changed the ordinance, and the Supreme Court dismissed that as moot over the dissent of a number of justices. So I think as you move further to just lawful carry, and that's one of the reasons I think the ad hoc committee was receptive to being clear that it didn't apply to the streets or towns or sidewalks that someone can lawfully possess their firearms on those spots. So if the town council wishes to adopt it, I do believe it would be upheld.
Mr. Freudman, followed by Ms. Berthelot. You're muted, David.
I keep forgetting. Thank you. I have a question for Mr. Deneen. I heard what you said, and I'm glad there was that change to the ordinance, so somebody isn't going to be violating an ordinance, by having archery equipment locked in their trunk. I understand the part about not allowing it in any town buildings. No problem with that. I just have a question about one town building, and that would be the parking garage. Does that mean that somebody with archery in their trunk, it would be against the ordinance if they were parking in the parking garage? And if it is, maybe an idea would be to have an exception for buildings. Can't bring them into any building except that's a parking garage or structured parking, whatever you want to call it. I was wondering your thoughts on.
Yeah, I believe that was addressed in the amendment that did pass the ad hoc committee. That was in the subsequent email from Tasha, where those items, if they're secured within the motor vehicle, would not be a violation of the ordinance.
Even in the parking garage, which is a town-owned building, and that is in the ordinance.
Yes.
So they did put. I didn't see this. It sounds like she sent a second one. So in the second one that she sent, there's an adjustment there for the parking garage.
I believe so.
Has been asked and answered. You will see such a protection in the revision in the ordinance, which is in Tasha Smith's email to you. Ms. Berthelot, is that the end of your question, Mr. Freudman?
Yes, you said it was answered, asked and answered. Not everybody has their computer on every minute of every hour to see if there's a subject to email.
I understand that Mr. Deneen answered it twice. Ms. Berthelot, followed by Mr. Shaken.
Thank you, Mayor. So I am thrilled. I think you've all done a fantastic job, and this is very, very thoughtful. I really appreciate the ad hoc committee's work on this. I know that we're not talking about the substance, and this is just about voting to have a public meeting. But there are some language things that I'm a little bit concerned about. Is sometimes we're using the phrase deadly weapon and other times dangerous weapon. And I think there's a distinction there that's important, and we probably should choose one or the other. And I also know, at least at the version that I'm looking at, the clause or deadly or dangerous isn't part of the when you're in a parking lot. It just lists the various potential weapons. I see Mr. Shaken's probably got a response to that. Thank you.
Mr. Shaken?
Thank you. Yes, I have a response to that. Terry, you're echoing. I don't see where the word deadly appears in this statute, so I don't believe we ever refer to deadly weapons. We're referring to firearms or dangerous weapons. That is the way that the Connecticut General Statutes define weapons, and so we took the definition from statute to make it clear. This is obviously something that in addition to being a municipal ordinance would be something that is enforceable by law enforcement. And so we wanted to be careful to not create a new definition that they weren't already aware of in state statute. I agree the language that was added in the underline that Tasha sent at 5:15, it was added on the fly by voice to take consideration of Mr. Ausberger's concerns in the meeting. And so I think when we get to the point following a public hearing, when we're passing an ordinance, we'll need to make sure we can make any other sort of technical corrections that might have been missed in the committee meeting. And that is one of them, which is to put a comma after archery equipment and say, and other dangerous weapons as defined in statute, et cetera. So yeah, to explain very briefly, I think the way that Connecticut statute works in terms of when and where a person who's lawfully able to carry a firearm is allowed to do so. If you're asked not to put it simply, by a property owner, and you do anyway, you're in violation of a state law. And so that's why we thought it was important to keep the definition the same as exists in state law. And I would make the motion, but I see Ryan's hand.
I would point out that Mr. Kotchenberger has added, in the chat, has given the new language. Mr. Aylesworth.
I just want to point out that I think where the confusion that Ms. Berthelot is pointing out lies is that the agenda item summary, I think, has a reference in multiple places to deadly weapons as opposed to dangerous weapons. And the proposed motion, showing italics on that, also says deadly weapons. So that language should be changed to reflect what I think is consistently stated correctly in the draft ordinance as dangerous weapons. So thanks for pointing that out.
Mr. Shaken.
May I make the motion?
Yes, you may.
Okay, I move effective today to schedule a public hearing for 7 p.m. at the Town Council's regular meeting on March 8th, 2021, to solicit public comment regarding an ordinance prohibiting firearms and other dangerous weapons in town buildings and on town real property, town-owned real property.
It's a committee motion, so it doesn't need a second. Mr. Shaken, you want to speak to your motion?
Sure. Thank you, Mayor. I don't know what to say that hasn't already been said. Besides that, you'll notice if you were listening very carefully, I modified the motion to be consistent with the language as Ms. Berthelot brought up. This is just a public hearing. I don't feel the need to discuss or debate the substance of the motion or the substance of the ordinance. We will hear from the public, and after that is the appropriate time for us to talk about the merits of such an ordinance at the council. So I will reserve my opinion until we hear from the public.
Anybody else wish to comment on the motion? Mr. Kotchenberger.
I support it, certainly. And thank you, Kevin, for it took a lot of background work to get this what looks like a simple motion amendment. One comment. I think we should. I mean, while it's clear in a number of places, I think when we notice this public hearing, we should make it very clear that it is virtual, that there will not be anyone at the town hall there. I mean, people may decide to protest. That's their right, but people should know in advance that there will not be a public hearing in the town hall.
Well, in the call to the public motion, there's usually Ms. King, maybe you can answer this question. How are calls for public hearings structured to include virtual ones?
Yes, they're very detailed, and they mirror a lot of similar language that you see in your council agendas that go out for our meetings and such, giving the public explicit instructions about how to participate or view the meeting or public hearing.
Okay, thank you.
My only point on that was that's great, and that is good, but then we should also be particularly clear that the meeting is virtual. Not only the instructions, but to make it crystal clear that this is a virtual meeting.
I believe
Will do.
The agenda starts with a description of well, you can look, public, it starts with it's closed, physically closed to the public, and it's, the descriptions are there. The word virtual doesn't appear, that's an interesting thought. Maybe, Ms. Chain, you can put something, a sentence in here that says not that it's just closed, physically closed, but that it is held virtually.
Yes, I'll make sure that it's very clear in the public hearing notice.
Thank you.
You're
Any
welcome.
further comments on the motion calling for a public hearing? Is there anybody who wishes to abstain from this motion? Is there anybody who wishes to vote in opposition? Seeing no hands and no signs of anybody wishing to vote in opposition, I rule that the motion has been adopted unanimously. Thank you to the committee for its work. Thank you, Mr. Deneen, for yours. I know that, as Mr. Kotchenberger said, the surface is short, but the depth is deep. So, thank you.
Thank you.
Okay, the next item on our agenda is the new addition to the agenda, and this is the appointment of a council member to the Mansfield Downtown Partnership. I have asked Mr. Bruder if he would be willing to take this seat, and he has agreed. So, if it's possible, I would entertain a motion to appoint Mr. Bruder to the vacant seat on the Mansfield Downtown Partnership Board. Now you see why I didn't want him to make the motion. Mr. Shuren.
I move to appoint Sam Bruder to the vacant seat on the Mansfield Downtown Partnership Board.
Is there a second? Seconded by Ms. Berthelot. I saw your hand first. Discussion? Mr. Osberger. You're muted, Mr. Osberger. Go ahead.
No discussion. I was just trying to second his nomination.
Well, it was already seconded, so thank you for your support. Any further discussion of the appointment of Sam Bruder to the Mansfield Downtown Partnership? Does anybody wish to abstain? Mr. Bruder?
I was just going to say that I would appreciate getting everyone's vote.
Okay. All right. Does anybody wish to vote in the negative? Then seeing no opposition, I will rule that the motion has been adopted unanimously. Welcome, Mr. Bruder, and I hope you enjoy this assignment. One of the fun things about it is you get to do volunteer work, and maybe you could hand out popcorn at a movie night or something.
I like to do that. Thank you all.
Okay, the next item on our agenda is new business. The first item is financial statements. This comes from the Finance Committee. So,
It's added to the consent agenda, Mayor. It's on the consent agenda.
Agenda, right? Sorry. Mary, you're excused from that, Mr. Kotchenberger.
Right, one comment.
Yep.
I mean, it's probably too late. I apologize. I should have noted when we were discussing the consent agenda, and I hadn't realized this might be put on it. I hadn't asked Charmaine, but I don't know if she has one or two comments she wants to make. And I don't know if it's possible to do that now. The news overall is good, especially on tax revenues, but I don't know if we can allow her to talk for a minute or two if she wants to. I should have noted this up front, but I didn't realize it.
Mr. Shakin?
Well, I guess it's a ruling for you to make, Mayor. My impression, based on our decision to add consent agendas to our agenda, is to forego discussions on these agenda items, because while they are sometimes informative, they can be agreed upon by the council, and the discussion happened in committee. So I appreciate Mr. Katzenberger's desire to have the finance director share some thoughts, but I thought that was kind of the whole point of the consent agenda, was to save us a little bit of time.
I agree. Unless somebody wishes to remove this from the consent agenda to allow for further discussion, I hope that everybody has read it, paid attention, and has no objection to its adoption. Mr. Friedman.
Mr. Parliamentary Inquiry, I agree with Mr. Shakin's assertion, as I understood it, that if people want to start commenting on this item, this is a case where if the rule is going to be that consent agendas not only don't have, debate and the vote, that you discourage discussion, then I would suggest that this is an example where, as you said earlier, a person could decide at the last minute to take it out of a consent agenda. I think that should be done in this case, so there won't be any question later. I would love to hear from Ms. Braddock Hill or Mr. Katzenberger or anybody on the voting member of the Finance Committee who has further insight into it. But maybe this is an example, subject to your judgment, of why this shouldn't be in the consent agenda. Let's just hear them.
The rule says that if any member objects to the inclusion of an item in the consent agenda, the item will be removed. Are you objecting to the inclusion of this item in the consent agenda?
No, I'm not objecting in principle to the consent agenda. What I am objecting to is if later on somebody wants to discuss an item that's in the consent agenda, that you might say, oh no, with the consent agenda, we don't have discussion. So I think this is a case where you either have discussion without a vote, I get that, but you either have discussion or you don't when something's in the consent agenda. I would like that clarified, so there is no question later on.
If you wish to have a discussion on an item on our agenda, and if it has been put in a consent agenda and you still wish to have discussion, then you request that it be pulled from the consent agenda and returned to the regular agenda for discussion. Items on the consent agenda are there to be straight up and down voted without discussion and without separate votes.
That's fine. Then there's a final comment, then that's fine with me. I don't have a comment to make, but if Mr. Katzenberger does or our finance director does, then I would suggest somebody has to suggest that it be pulled so they can make their comment. That's all. Pulled out of the consent agenda.
Katzenberger, do you wish that this be pulled from the consent agenda?
I do, and I apologize again because I would have noted this up front. I think in the future these items, the quarterlies might be suitable for the consent agenda, but anyway, all right, I'm sorry. Let's keep to the rule. I mean, the rule we said not to. That's fine. Let's just move on. In the future, I'll remember that the quarterlies, there may be comments or questions that whether it's the finance director or member, might come up after that. And since we're talking about the town finances later on, but I'll withdraw. If it was a motion, I withdraw it.
I would recommend that one of the things that the consent agenda process requires is that people review the materials in our packet well before, and if there are questions on an item that might be placed in the consent agenda, that you reserve your right to request that item be removed. The point of the consent agenda is to move things without discussion and without a separate vote. So if you have a request for something to come off, then be prepared to ask for it, because it makes sense to ask for it if you want to talk about it. And if you think, an item of importance for the public to hear, other than to read the documents. Mr. Freudman.
To follow up on what you just said, Madam Mayor, I think that is in line with what I said earlier. Let's not come up with consent agendas at the last minute. It's got to be It should be, part of our agenda so we know ahead of time, and then somebody could say, no, that's something I really want to talk about, and then they could say right up front, let's pull it. So that's
Well,
just.
the financial statements have been on the agenda since you first received the agenda. They were also on the Finance Committee's agenda, and there was a discussion of them there tonight. So by the time the motion was made to put these items on the consent agenda, anybody who wished to have further discussion on any one of the items should have been prepared to request that it be pulled at that time. And it can be pulled at any time going down, but this is the process. You move to put something on the consent agenda. If anybody objects, it comes off. If it's on the consent agenda, it gets voted in a packet without discussion. Mr. Aylesworth.
Well, I just realized after I put my hand up that Deputy Mayor Shaken stepped away, but I know that in the last meeting that was had on this, I believe that the structure of the agenda was done this way specifically to help us ease into the consent agenda process. So it was with the best of intentions. I see he's back now. Maybe he wants to speak to that, but I just want to make sure Mr. Freudman knows that there was a certain amount of thoughtfulness that he was putting into this to try to help actually make you more comfortable with it, the concept.
The one thing that was missing is we didn't include a line called.
Yes, that was omitted. That should not have been. But the reason why items specifically weren't listed under the consent agenda was discussed.
Yes. So, Mr. Katzenberger.
Thanks. Just to clarify, because I had sort of the same question I guess David did. So in the future, will council members or the mayor, in setting an agenda, recommend specific items that should be on the agenda, and then their consent agenda, and we'll see that in advance? Because I think that was the issue. Was not that it should, not that it should or shouldn't be, but that it's better to know in advance. But
Well, if you would like, Mr. Shaken, Mr. Aylesworth, and I can construct the consent agenda in advance rather than moving things onto it in the course of a meeting. Mr. Shaken.
I don't think it has to be either or, but I think that would be helpful. Thank you.
There was a significant amount of concern expressed by a member of the town council that a consent agenda would simply create a vessel for the mayor to ram through her agenda without the input of the town council. I'm paraphrasing here, but the idea to not have the mayor, when she sets the agenda, set her recommendation for a consent agenda was proposed as a way to assuage those concerns. That the council would decide on a consent agenda collectively at the beginning of a council meeting, rather than the mayor proposing what she would like the council not to debate for a council meeting. However, if the recommendation is now that the mayor propose a consent agenda prior to the council meeting, that would also be perfectly acceptable and would work fine. We have now, I would also note, spent significantly more time discussing a 2-item non-controversial consent agenda than we would have spent discussing those 2 non-controversial items.
I would point out, however, that this is a new process for us and it's a learning experience. Mr. Shuren.
Now, I was just going to say that I would prefer that the agenda as it's sent to us say, here's the consent agenda and the items that are on it, so that we don't have to be so quick when the council meets to know what is being added to the consent agenda. If we could see it beforehand, we would know which items we wish to have withdrawn.
Okay, we will do that. In the future, we will prepare a consent agenda as part of the agenda. Mr. Bruder.
Correct me if I'm wrong. I don't know if we need to add this as a future agenda item, but if we've already made the rule and agreed to it, I don't know if we can, right here, procedurally, go ahead and change that, but without adding it to the agenda,
We aren't changing anything. It's just a matter of discussion of how it's implemented. Mr. Freudman.
What Mr. Bruder just said reminded me of something, that when we changed the council rules of procedure, consent agenda, if there was to be a consent agenda, would be at the top of the agenda page, right after reports and comments of council members or something, right there at the top. So adding it later in the meeting isn't following our own just recently adopted council rules of procedure. The second point I want to make is to Mr. Shakin's point that I think he was referring to me, thought that a consent agenda would be used to ram through things. Look, I said earlier, I've accepted the rules and very important, in the council rules of procedure, I feel you put in language in there saying that anybody could pull something off of the consent agenda. And I consider you people of goodwill, and I've accepted that. So I'm sorry that was brought up. That may have been my suspicion earlier, but you did put language in the council rules of procedure that until it's not adhered to, I have no problem with. But once again, council consent agenda has a place in our, in the order of business. I think it's called the order of business that's in our town council rules of procedure. And we're not even doing that. You wouldn't put roll call at the end. Things are in sequence, new business, old business, you know what I mean. Anyway, that's my comment.
All right, thank you. Then the next item on our agenda is the staffing for the adequate fire and emergency response. Mr. Aylesworth.
I'm going to turn things over to Acting Chief Franklin. And this is obviously spelled out in the AIS. I just wanted to start off by underscoring that at this time, council action is needed to authorize us to apply for the grant. That's not the same thing. And this was done intentionally. You would not be authorizing acceptance of the funds because there's more deliberation in the coming weeks and months that needs to be done between the time the town submits the grant application and the time we receive notice of our grant being awarded or our denial. But it would give the incoming fire chief a little bit of time to familiarize themselves with the department, get up to speed on the fire study, and ultimately, in partnership with myself, provide recommendations to the council in the future about whether to proceed with accepting any grant funds if they are received. But I will let Acting Chief Franklin walk you all through exactly what the Safer Grant application entails and what positions is funding and a summary of why.
Thank you, Town Manager.
Welcome, Mr. Franklin, Chief Franklin.
Good evening, council members, mayor. Correct, the fire department comes to you today to talk about applying for the FEMA Safer Grant, the Staffing for Adequate Fire and Emergency Response Grant that provides a level of funding for fire departments in order to meet staffing levels. Included in the budget packet, again this year, the fire department requests for 4 additional firefighters to help us meet the NFPA 1710 staffing recommendations. And I refer you to the Fitch and Associate study that the town paid for, and the final report was provided in December of 2020 that talks specifically about the shortcomings of the current staffing system and how to further meet those staffing recommendations into the future. And this would be our first step into going to meet those. If anyone would have any questions, I will try to answer them now.
I would only ask the financial impact for years 4 and 5. The position's salary and benefits, direct costs are fully covered for the first 3 years. A rough approximation of the cost for year 4 and 5 are included in the summary. Hence the need to, complete our deliberations, knowing that there will, after the first 3 years, there will be significant financial consideration moving forward.
This is what we used to call camel's nose, right? And the feds are going to fund 4 positions on the condition that we fund them at least for 2 years and preferably forever. So I think that as we consider this particular grant application, I think what Mr. Aylesworth is asking us is to allow him to write the grant application and then to decide whether to accept the grant when we get it. So, Mr. Bruder, followed by Ms. Berthelot.
I was going to make the motion if there was no more questions.
Any more questions? Mr. Katzenberger?
Thanks. I mean, I think it was clear, but I just wanted to ask Chief Franklin. I mean, quite aside from where the funding comes from, which is a big issue, do you think we need these extra? I mean, in the sense of, is this? I understand it would meet the requirements under this program you described, but is this something you also would agree that we need? Because if you don't think so, even if we get the grant, then I don't think there's any need to pursue it.
Thank you, Mr. Koschberger. That's actually an excellent question. The fire department has, through various needs analysis and studies, and culminating in the Fitch and Associates study, has identified the fact that the fire department has been understaffed for some time. And specifically when the downtown project was produced, all those apartments and all that infrastructure was added without significantly adding to the fire department staffing. So we're at the point now where we're really getting behind the 8 ball, and we need to provide additional staffing. And that is evident in the Fitch report. And I would also add that this would not be a 5-year plan. This is part of the beginning of a multi-year plan to add not only these 4 positions, but more positions.
Mr. Shuren.
Yeah, I just want to make sure, you may have said this and I missed it. By applying for the grant, should it be awarded, we could reject it, but have we made a commitment that can be, are we stuck when we say in good faith we're applying for this grant and we will comply with the conditions of the grant if it's awarded?
As a general rule, I would say that, it's not a practice I would promote doing frequently. There certainly are cases where, for any number of reasons, including in the case of like a matching grant program, if a town or city doesn't have the ability to achieve the match after it's applied, that it may turn down the grant. And what makes these particular circumstances a little unique, and this was not obviously the way we envisioned the timeline when we originally advertised for the fire chief position in the fall, is that we've had a sort of unavoidable delay in the hiring of a new permanent fire chief. And given that clearly, the staffing picture, staffing needs analysis, everything that's been studied and evaluated as part of the fire study, and ultimately, the future of staffing in the department is something that a new permanent chief, in my view, should absolutely weigh heavily into. We kind of find ourselves in this time frame where this would allow us a little bit of time. There would clearly be other applicants that, if we declined the money, would be on the receiving end or beneficiaries of that. My understanding is this grant, like assistance to firefighters grants, there are multiple rounds in which awards are given. The expectation being that certain awardees will ultimately decline what's being offered. And so I don't think that we would be in a highly unusual camp by doing this. Again, it's not ideal, but I think under the circumstances, while we bring on board a new chief, it would be prudent for us to do this at this time.
Okay, any further questions of the staff on this? Are we ready for the motion? The motion is on page 89.
90, Mayor.
Let me get there. Yes, 89, on page 90. Mr. Bruder.
I move effective February 22nd, 2021 to authorize town manager Ryan J. Aylesworth to submit an application to the Federal Emergency Management Agency FEMA for a staffing for adequate fire emergency response safer grant.
Is there a second? Ms. Berthelot seconds.
Just
Mr.
quick,
Ruder.
Mayor, to speak in favor of my motion, I agree with our town manager that we typically wouldn't want to spend staff time and resources in creating applications for which we didn't think we were going to go forward with or find necessary. However, given the circumstances we're in with our fire chief search, and I know that since I've been on the town council, there's been a need for at least additional fire staff, and so I'm hoping that we can get the new fire chief in and then move forward with this grant application if we decide to take it.
Mr. Aylesworth?
I just want to circle back to something you were saying a moment ago, Mayor, just to put a finer point on this and be entirely transparent, because I think you hit the nail on the head. By applying for the grant, it's obviously, it would be helpful to have financial support for a 3-year period, and that financial support would be significant because you're looking at somewhere between a $400,000 and $500,000 a year price tag. However, the finer point I want to put on this is that really the council and town administration needs to render a decision about what it believes is in the best long-term interest of the town, because this is a much longer-term financial commitment. It would be nice to have a few years where those costs were offset, but really you can almost set the grant aside and say, is this something we believe, based on the evaluation that's been done, the need has arrived, the town can't afford to not do this anymore from a mission delivery standpoint, public safety standpoint.
And I think we would need to hear that from a fire chief.
I believe that, you've heard from a number of qualified experts already and the former permanent chief in terms of the fire study. It's not that qualified opinion hasn't been brought to bear. I just believe that is, again, part of the sort of shared ownership of this. It's only right for the next permanent fire chief to have an active voice in such a consequential decision.
Mr. Freudman.
Yes, thank you. For a moment there, Mayor, I thought you and I were in rare agreement when you used the phrase nose of the camel nose or something.
Yeah, we may be.
We may be. Well, as you know, I speak my mind, and yes, I just see this as further growth. There hasn't been a demonstrated, and I'd like to point out a few things. As I'm sure all my council colleagues did, you perused again the fire study that was delivered to us just 2 months ago at the December 14th meeting. And what I gleaned from that is a couple of interesting facts. There are about 2,300 calls for service a year, which is an average of 6.4 per day. That's 6.4 calls per day spread out over 3 departments in the course of a 24-hour day. That's the average. A couple of other things that were in the study, which is a big thing for people that are in the emergency services field, is response time. And as I'm sure you all recall from the packet of December 14th on page 53, I don't have to tell you that, I'm sure you all know that. It said that our response time now is 11.7 minutes. And I think I asked a question or two about that and said that's actually pretty good for a rural community. We're spread out over 45 square miles. We're definitely delivering a service. Now, of course, the standard is they want to bring it down to 8 minutes response time. Well, we probably should have a fire station every mile and a half in town. And me being a bit cynical and a bit outspoken, I'm sorry, a bit irreverent. If in 8 or 9 years from now, I can see that the trade groups will say, people who are at 8 minutes response time, there's a new standard now. We've raised the bar. You really should be 6 minutes. Look, I think we're doing pretty good. We have added a couple of firefighters in recent years, and I think we're adequate. We can't keep adding, and this is costly. It is a 5-year commitment. For the first 3 years, we still have to spend a lot of money on training and equipment, the uniforms and the fire resistant gear. It's very expensive. And then as we see from the narrative on years 4 and 5, the estimate is $450,000 a year. And why is it that I think it'll be higher than that with inflation and other costs, ancillary costs that aren't reflected here? I just see this as, further raising the ratchet for more and more. And I will vote no on this. I don't see a critical need.
Mr. Bruder for the second time.
I just want to point out that as somebody who lost his house in a fire when I was in elementary school, the difference between 12 minutes and 8 minutes can be big. Luckily, nobody, no humans were injured. But again, this isn't what the debate is on. Today is just on whether or not we should submit this application. So hopefully when we submit this, everyone votes, we get a majority who say yes, that we'll then be able to have the discussion as to whether or not we want to accept it and do it based on, I'm sure, a more detailed plan that will be brought to us, I'm anticipating, by our new fire chief. But again, for today, it's solely for the authorization for the town to submit the application, for which then we can have more detailed debate.
Okay, does anybody else wish to speak to this? Mr. Freudman for the second time.
Very briefly, as you all know from that study on page 65, 0.9% of their calls for service are for fires, and half of those are outdoors, which I imagine means brush fires. And I'm sure, I get the feeling that a lot of their calls, as important as they are, because you never know, false alarms and, situations not as dire as somebody having a raging fire in their house, very, very rare, and there's a tiny, tiny percentage of their calls. And as I mentioned before, our response time is pretty good.
Mr. Shaken.
Thank you, Mayor. I think the council needs, as others have said, to finally make a decision on this. We've spent a lot of years doing research. I look forward to having that conversation with the new chief. I don't see any reason why we shouldn't apply for money to help pay for it if we decide to go forward with it, even though it puts the cart a little bit before the horse. I have to say, Mansfield's a very different place than it was 15 years ago. And 15 years ago, Mansfield was a very different place than it was 15 years before that, and 15 years before that, and 15 years before that. And the needs of the community from a fire response and other emergency personnel response perspective change as the community changes. And we are certainly anticipating further community changes. It would be ludicrous of us not to, frankly. And we have also made a number of decisions as a municipal government to promote those changes. And so we have an obligation to our citizens to properly fund an emergency response apparatus so that we can manage their emergencies. It is one of our primary responsibilities as a municipal government, if not our sole or our, and if not our single primary responsibility. So we'll certainly have a lot more to say about it, but the grant application makes sense, and I will be voting for it.
All right, any further comment on, are you ready to vote on this motion? Is there anybody who wishes to abstain? Is there anybody who wishes to vote in the negative? Mr. Freudman wishes to vote in the negative.
Can we have a roll call vote on this, please?
I think I can see hands pretty well, Mr. Freudman. Mr. Frattoni and Mr. Osberger also have raised their hands to vote in the negative. Is there anybody else who wishes to vote in the negative? And is there anybody who wishes to abstain? Then I am going to rule that the motion has been adopted by a vote of 6-3. And this is a discussion which we are going to have in much greater depth at a later date. Obviously a very important one, and one on which there will be some significant discussion. The next item on our agenda is the citizens.
Parliamentary inquiry, Mayor.
Yes.
I'm sorry to interject like this. I'm not clear on something. We kind of were getting into a discussion back and forth about the consent agenda. Have we formally adopted? Do you need a vote on the consent agenda to adopt to approval of the minutes and to adopt the financial statements? Have we done that? Because I don't remember a vote.
When we get to the bottom of this agenda, that will be where the consent agenda is. It follows the Citizens Academy, but according to Mr. Shaken's original motion. And so at that point, we will have a vote on the consent agenda, if people wish. Okay. Mr. Aylesworth on the Citizens Academy.
I will be brief, and I hope this will be well received idea in any case. I apologize because I did a last minute kind of name change or branding, I guess, change Friday late in the day. So what is printed on your agenda is the Mansfield Citizens Academy, the agenda item summary, and the very tentative working version of a course or program schedule has been redubbed the Mansfield Local Government Academy. Did that for a few different reasons. Citizens Academy are often associated, people see in their mind's eye a police academy, because a lot of these are specifically citizens academies for police activity or police departments. And so as the summary document you have before you lays out, what this is basically intended to do is provide an opportunity for people who are interested in learning about the inner workings of their local government, an opportunity to participate in a series of sessions that gives them exposure basically to all aspects of local government. So again, the model is similar to what has been done in many places. I believe Mansfield might have even had one of these at one point, a Citizens Police Academy. But whereas that focused on basically the ins and outs of one specific department, one specific function, this is a broad brush introduction to anything and everything, including the functions of different boards and committees. It's often somewhere between 10 and 15 sessions. This has been devised as 13 classes, each session dedicated to a specific department or functional area, i.e. Public Works is its own session. The idea, as I said, is to expose people who are interested in these topics, who want to learn more, an opportunity for them to learn more, kind of see behind the scenes, have direct access to department heads and others to learn what's going on. In addition to a more educated pool of residents and citizens, it also provides an opportunity for people who or maybe pondering the idea of serving on a board or committee or running for elective office or anything like that, some other means of getting more actively engaged in local government, an opportunity to get a primer in all things local government and inform their decision. Maybe they decide they want to serve on the Planning and Zoning Commission as a result of going through this program. A lot of different towns and cities across the country have tried programs like this. Not so many that, you know, every community out there is doing it, but it's not that uncommon. Those that have done it report good results. Obviously, this past year, you know, COVID would be a very difficult circumstance to envision doing this. Doesn't really lend itself so well to a virtual format, because you really want to give people an opportunity to, you know, see what's under the hood, literally in the case of, you know, like the fire department, looking at apparatus and that sort of thing. So this is obviously, you know, COVID dependent. We're not gonna, I would propose rolling this out in a situation where we're not post-pandemic, but is something that you can anticipate me including in my eventual series of budget recommendations. This is a very low dollar, you know, we could probably, hopefully, I'm hoping, find a program sponsor for this to offset all the costs, but Costs are nominal. You're talking about providing food and refreshments for attendees because these would be evening sessions. So you want to provide them at least a light meal so that they're not missing dinner. And then some recognition items at the end of the program. We're toying with the notion of a framed certificate of completion and maybe a limited edition Town of Mansfield sign depicting our new town branding that was adopted in recent years. So that's kind of an overview of the program as it's being contemplated. The only other thing I wanted to mention was that there shouldn't be really any additional direct costs in terms of staff involvement, because for the most part, a given session will be led by a salaried department head. So it might necessitate that they adjust their work schedule that week if they have an evening. They may offset their work hours accordingly, but there really wouldn't be additional direct financial impact beyond those nominal costs I mentioned. So that's an overview. It's very much a work in progress, but I hope the council will support the broad aims of this program, to promote citizen engagement and interest in their local government.
I don't know if Mr. Shuren has had this experience, but when I was teaching state and local government, one of the things I would do is ask students to go visit their local town halls, and most had never been in their local town halls, and they were amazed at how welcoming those folks were and how interesting it was. And then when I would take my students on a day-long tour of the state capitol, their sense of what government was and how it worked totally changed, and they began to get really excited about the potential for being part of it. And many of them did not start out that way. So I think this direct contact is extraordinarily important. People have very, very limited knowledge of what local government does and how much they benefit from the services. So I really strongly support this proposal. Other comments? Mr. Shuren.
Just a question, will you limit the size to 15 to 20? And if you have more than that who want to participate, what will you do?
Yeah, so it'll be an interesting problem to have, to see exactly what the demand is. I think I'm not in a position right now. Others here might be able to kind of project out how many people you think will come forward. I know 15 to 20 is a very common size. I think, it might be a little daunting. I haven't ruled it out. It might be a little daunting logistically to contemplate breaking it up into multiple cohorts and kind of doing it simultaneously because, again, we want to be realistic and manage the time that's necessary to invest from staff standpoint if they're going above and beyond and taking part in an evening session. Not off the table, though. Definitely would consider the possibility of doing that. But honestly, as funny as it might sound, in reviewing other programs, being offered by other municipalities, they will often say kind of front and center that, they'll stop short of saying this is a competitive program, but they'll say it's capped at a certain level and not everybody, might be admitted. And if you're not able to get in the program this cycle, we hope you'll, do it again in the future. So kind of one or the other. I don't know whether we'd split up into multiple cohorts, or ask people to participate in a future program. But frankly, I think that'd be a good problem to have if demand is so high.
Yeah.
Anybody else wish to comment? Can I take the lack of commentary to be a general consensus that this is a good idea? Yeah, I'm here seeing a couple of yeses. And David says yes too, somewhat reluctantly, but I saw his thumb up. So I think you can take this as encouragement to proceed with this, and if there's any way we can help, we'll be glad to do so.
It's already bringing people together. Look at that. We haven't even launched the thing. It's already the big consensus.
All right. Next item on the agenda is the consent agenda. So we have two items on the consent agenda. We have the minutes and we have the financial statements. Are we ready to vote on the consent agenda? Does anybody wish to abstain from the consent agenda, which includes the minutes and the financial statements? Does anybody wish to vote no on the consent agenda? Then I am assuming that the items on the consent agenda have been passed unanimously. Thank you, one and all. Reports of council committees. Personnel, you met earlier tonight.
Yes, it seems some time ago, but it is true. We didn't meet, and we had a productive discussion about going forward with the town manager's 6-month review, sort of doing a bit of Monday morning quarterbacking relative to past experience, and then trying to ensure that we do an excellent job this go around.
And you didn't reach any particular conclusions, so the rest of this will be forthcoming?
Exactly. We've asked town staff to help us and give us some ideas about the best practices to ensure that we involve as many stakeholders as possible in the initial review.
Any questions for Ms. Berthelot regarding the Personnel Committee? Mr. Konchenberger, Finance?
Yes, the Finance Committee met this evening as well before the Town Council meeting. The material, it was on the consent agenda, and we put it on and it was voted. So I can obviously comment on it, but I think that's pointed out, that's the purpose of the consent agenda. I will say one thing though, because this is good news, and that is the tax collections are very, the percentage rate is very good. It's one of the best around and is roughly the same as pre-COVID. So that is good news.
Thank you. Committee on Committees?
Thank you, Mayor. We did not have a meeting this past week or since the last meeting, simply because there was no pending applications or pressing business. But we did, if I could switch and say for the affordable housing.
Yes, please.
We did meet, and the big takeaway is that we have looks like about a 5-month plan, which includes a public hearing and meeting. It also includes developing a survey that will likely be online, but we're talking about how to notify people, whether it be through possibly a postcard or some other mechanism that people can then have access to the or awareness that the town is looking for their input. So that's the next big step, and we're pushing forward.
Thank you. Any questions for Mr. Bruder? All right, the next item on our agenda is departmental and advisory communications and committee reports. And after that is petitions, requests, and communications. It's a little early to know, but obviously Mr. Courtney and Mr. Larson are working to help continue some coverage for people with crumbling foundations. This has not been a terribly significant issue in our town, although as time goes by, the number of residents who have encountered this problem is probably going to grow. So fortunately, we aren't as bad off as some of our surrounding towns with hundreds of crumbling foundations and crumbling schools as well. So next item after, does anybody else wish to comment on this? Ms. Berthelot? You're muted.
I'm sorry. Were we doing future agendas, or were you just focused?
We just got there.
Okay. Are we there now?
Yes.
Thank you, Mayor. I'm hoping to have a conversation about our program where we have grants that we give money to community organizations in the area who support our community, but also particularly programs in Willimantic, because they have such excellent services that we want to support. For instance, soup kitchens of that ilk. And every year when we get to the budget, it seems like it catches us unaware that the way that we're the grant applications, how they work, and how it is we're advertising about it, and how we evaluate who we're going to give grants to. So prior to the budget process, I would like to take a look at that process.
Mr. Aylesworth, can we schedule something like that for sometime prior?
Yep, I was just making a note of that while Ms. Berthoud was talking.
Good. Any other, I agree with Ms. Berthoud, this is a necessary item. Any further items that you wish to add to future agendas? No? There's only one item left on our agenda. Is there, Ms. Berthoud? Moves to adjourn, and Mr. Bruder seconds. Thank you, everybody. Thank you for your careful thought about some of the things that have been on our agenda, and your participation. So, see you all in a while. Hope you all stay well, get vaccinated, and we can one of these days meet in person. Good night.
Night, everybody.